is from Professor Lee. She is not going to present online. We have a recorded video because she couldn't be here today. So she is an oncologist, radiotherapist from Korea, and she's going to speak about pediatric application of modulated electro-hyperthermia. So please, you can put it.
Hello everyone. Due to the coronavirus disease-19 epidemic, I am sorry that we are not able to meet in person at conference and to lecture online. My name is Seonyoung Lee, Department of Radiation Oncology, Jeonbuk National University Hospital. The subject of this lecture is the result of hyperthermia in pediatric cancer. This lecture will be done in the following order. First, introduction of treatment of pediatric cancer. Second, palliative aim hyperthermia for cases. Third, definitive aim hyperthermia for cases. And last, conclusion. The pediatric oncology has numerous tasks that are difficult to handle with conventional therapies. Most of the cancers that are common in adults differ from those in children and adolescents. In the last 3 decades, the mortality from pediatric cancers has been cut in half, which is a remarkable result, but many cases are difficult and challenging and often do not have conventional protocol. In particular, in the case of radiation therapy for symptom-naive purpose, it is difficult to perform if the patient is in poor condition because reduce patient compliance. If the child does not cooperate with the treatment at each treatment time, he should sleep with a sleeping drug. Radiation treatment side effects were also not negligible. So we consider the hyperthermia. Hyperthermia is a treatment that does not need to sedation the patient, and the patient emotions are stabilized during treatment as it can be accompanied by a parent. It is an optimal treatment that can be used for pain control purposes without side effect. So, first, I left for case of hypothermia for palliative aid. The first case was a 4-year-old boy. The patient was treated with concurrent chemotherapy and radiation therapy, but there was no change in the size of the lesion and symptoms such as headache, vomiting, or complaint. Therefore, since radiation treatment was already performed, additional radiation treatment was not possible. In addition, the patient was unable to sedate sleep even through additional radiation treatment was possible due to the nature of the disease. The image was before hyperthermia. Also show a high signal at T2 weight imaging and mass that does not enhance contrast is still observed and is still extended to frequency. He underwent Oncotherm. Oncotherm was underwent decubitus purgation at brain. He was no sedation. Oncotherm underwent 36 sessions. This image was after hyperthermia. The overall size of the expansile tumor mass on the front is slightly reduced. His decreased tumor volume and decreased symptom above 50% and decreased painkiller drug. He was no complications related Oncotherm. Last follow-up status was death. Survival period was 62 months. In the second case, the patient was a 2-year-old girl who received several anti-cancer treatments such as chemotherapy and radiation therapy and surgical excision. but the lesion was still progressive and further anti-cancer therapy was not possible due to the worsening of the systemic condition. Symptoms such as severe pelvic pain, nausea, vomiting, and anorexia were confirmed, and there was no other treatment available.
Ist das immer gleich, wie das modelliert wird? Weil das
This image was before hypersomnia. The main region in the free sacral area forcing the rectum forward. The boundary with the rectum is relatively clear. The mass destroys and encases part of the lower rectum and coccyx bone. Oncotherm underwent composition and pelvis. She was no sedation. Oncotherm underwent 9 sessions. She could not perform the image examination because very poor general condition and could not sedation. But she decreased the symptom above 30% and decreased the painkiller drug. He was no complications related to hyperthermia. Last follow-up state was death and survival period were 40 months. In the third case, the patient was a 2-year-old boy diagnosed with neuroblastoma and received severe anti-cancer treatment with anti-cancer drugs, surgery, and radiation therapy for palliative purpose. But the lesions continues to progress. Progress and radiation therapy for symptom relief was no longer possible to implant because of not to sedate. In the case of pain reliever, but the effect was insignificant after an hour after drug administration. Image was before hyperthermia. The tumor grew much more in the bone growth surface and in the sub-periosteal space. The lesion is spread abroad from the distal tibia platform level to about 9 cm, and the periosteum is generally lifted and the mass is fair. Oncotherm underwent sitting position at lower back. He was no sedation. Oncotherm underwent 28 sessions. He could not perform the image examination because very poor general condition and could not sedation, but he decreased the symptom around 60% and decreased the painkiller drug. He was no complications related to hyperthermia. Last follow status was death. Survival period was 36 months. The first case was a patient with a dermoplastic small cell tumor of the abdomen who received several chemotherapy treatment, but the lesion was still progressive and further chemotherapy was not possible due to the worsening systemic condition. The extent of the lesion was too wide to perform radiation therapy for symptoms relief purpose, and radiation therapy could not be performed due to the inability to maintain a fixed posture for treatment. Image was before hyperthermia. Scaffolding mass observed around river periportal Harlem and common bile duct accompanied by diffuse biliary dilatation. Severe no attenuated lymph node enlarged in the periportal photocover, outer cover, and para-aortic area. Oncotherm underwent supine position at chest and abdomen. The patient complained of severe pain due to a mass near the chest and diaphragm. Also, the mass in the abdomen was enlarged at the time of the hypothermia. So, hypothermia was performed to site at abdomen and chest. He was no sedation. Oncotherm underwent 29 sessions. Image was after hyperthermia. The metastatic region sizes more increased, but he decreased symptom of 30% and decreased painkiller drug. Here was no complication to related hypothermia. Last follow-up status was death. Survival period were 36 months. Palliative hyperthermia can be usefully used for treatment in the absence of the adolescent treatment. In the case of treatment that requires sedation, it is a treatment that can be performed when the patient does not sedate and improve the quality of life of the patient by reducing pain and no obvious side effect and help to stabilize the patient mind and body as treatment can be carried out with the parent. And next, I introduce the rapid aim hyperthermia. In particular, in the case of lymphatic cancer, radiation therapy is often performed after chemotherapy. At this time, since the children are in the growing stage, chronic side effects such as growth retardation, metabolic disease due to hormone imbalance, and bone growth delay occur depending on the irradiated area. As the average survival period of a patient increases, various treatments are applied to reduce chronic side effects. So we consider hyperthermia. The first case was the patient was a 1-year-old boy with neuroblastoma at chest who received several chemotherapy and surgery. This patient was scheduled to undergo radiation therapy after chemotherapy, but the patient parents were concerned about the delayed bone growth among the side effects of radiation therapy, so they decided to perform hyperthermia. Image was at first diagnosis. This region is reactive reactive hyperplasia thymus. This region is best region. This image was before hypothermia. The best region decreased later. So Oncotherm underwent supine position at chest. Here was no sedation. Oncotherm underwent 12 sessions. The image was after hypothermia. All region is gone over. He is complete remission after hypothermia. He is no complication related to hypothermia. Last follow-up status was alive. With no evidence with a disease and survival period are 16 months. Then the second case was the patient was an 11-year-old girl with Hodgkin lymphoma at tonsil and both neck who received several chemotherapy and surgery. First diagnosis, multiple enlarged lymph node observed. This region, this image was before hypothermia. Many regions sizes is decreased. Hypothermia underwent supine position at neck. He was no sedation. Oncotherm underwent 24 sessions. Because this patient was scheduled to undergo radiation therapy after chemotherapy, but the patient parents were concerned about delayed bone growth among the side effects of radiation therapy, so they decided to perform hypothermia. This image was after hypothermia. All region did not observed. He is complete remission after hypothermia. He is no complications related to hypothermia. Last follow-up status was alive with no evidence without disease and survival period of 42 months. In the third case, was the patient was a 6 years old boy with Hodgkin lymphoma and neck axillary and mediastinal lymph node who received several chemotherapy treatment. This image was a diagnosis. Right supraclavicular, axilla, and mediastinal enlarged lymph node observed. This image was before hypothermia, many regions sizes decreased. Oncotherm underwent supine position and neck and mediastinum. Here was no sedation. Oncotherm underwent 24 sessions. This image was after hypothermia. All regions did not observe. He is complete remission after hypothermia. He is no complication related to hypothermia. Last follow status was alive with evidence without disease. Survival period are 27 months. The first case was the patient was a 15-year-old girl with Hodgkin lymphoma, both neck and lymph node, who received several chemotherapy treatment. This image was the first diagnosis. FDG avoid lymphoma involving lymph node and left cervical level from 2 to 5, right cervical level 2 and right supraclavicular areas. This image was before hypothermia. Decreased size compared with the previous FDG case. Oncotherm underwent supine position at neck and mediastinum. She was no sedation. Oncotherm underwent 24 sessions. She did not evaluate the radiology examination yet. She is no complications related to hypothermia. Last follow status is alive. Survival period are 10 months. And last conclusion, with the development of anti-cancer chemical these days, the average survival time of childhood cancer patient is also increasing. Previously, the purpose of the treatment was to remove the mass, but the recent treatment focus not only on the removal of the mass, but also on the reduction of acute and chronic side effects. In the case of pain relief purpose, if it is difficult to calm the patient, work operation is difficult, and an alternative to radiation therapy can be tried. And hyperthermia can be used for pain control and helps improve quality of life. Since there is no specific side effect, it can be tried if the existing treatment is refused due to concerns of chronic side effects. This lecture is over. Thank you for your attention.
So thank you to Professor Leo, although she is not here. I don't see questions. We don't have much time, but I know Professor Sass is familiar with Professor Lee's research. So if you want to ask something, maybe he can answer that. I just want to comment that it's very interesting what Professor Lee presented, because I think it opens an interesting field for children with a special population, and for hyperthermia applied in monotherapy, which can be also very, very interesting. So thank you for that. Yeah, I see Professor Bangol, the question. Maybe you can ask on your own, or I can read it. He wants to know the exact dosing of the electromodulated hyperthermia. I don't know if Professor Sass knows something about this.
So I would like to answer all the questions which related for this this lecture. But you know that the specialties, it means that medical specialties which are not involved in, that may be the best if you are addressing in chat form or written form, emailing directly to Professor Lee or emailing to me, and then I will connect Professor Lee about this. I'm very much sad for that one, that she could not participate because of the engagement. But if you have a question which maybe that I can answer that, please ask, and then I I will do my best.
Yeah, okay, yeah, so I think it's interesting to have questions by email or something because we are a little bit late. So